Alrighty, here we go. Hello everyone, and thank you for watching this program on the best sprain, strain, and myofascial pain codes. There's no audio taping or videotaping, and any unauthorized reproduction, dispensing, forwarding of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not intended to be a substitute for your thorough clinical decision making, and should not be construed as any written policy for any federal agency. It's not intended to be legal advice. Target coding does not engage in providing legal services. If I discuss CPT codes, that's a registered trademark of the AMA. I've made every attempt to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. A little bit about myself before we get started. My name is Dr. Marty Kotler. I am a chiropractor. I'm also certified in CPT coding. I am a certified professional compliance officer. I practiced for 16 years before I started my company Target Coding. My areas of expertise include HIPAA compliance, coding, documentation, Medicare, creating compliant cash plans, and CPT ICD-10 code pairing. I've written many books on billing and coding and documentation for chiropractors. I write articles for chiropractic economics and dynamic chiropractic. I'm a featured speaker for the Coding Institute, Parker Seminars, Foot Levelers, plus I'm a guest speaker at many state association conventions nationwide. Okay, so sprains, strains, you may have heard these terms over the years. I'm just going to do a little recap here. Some of it is basic. So sprains. Sprains relate to overstretching or tearing of ligaments. Ligaments connect bones together. That's where we form the joint. Most common type of sprain is of the ankle. You may see bruising. Patient will experience pain, swelling, limited motion. And long-term treatment may be required. Sprains take longer to heal than strains. And there's a way of grading sprains. Grade 1, minor damage. Most ligaments are intact. The patient, if it's a sprained ankle, let's say, grade 1, the patient could typically continue to walk with some pain. There's localized tenderness, a hard end field. There's no instability. There's minor damage and most ligaments stay intact. Then we get to grade 2, considered moderate. Now we're going to have partial tearing of the ligament. Abnormal laxity. There's some instability. There's swelling, bruising, compromised function. And then we have sprain of grade 3, severe. Now we have severe instability, a complete disruption, complete tearing of the ligament with significant instability. The joint just does not work. The patient could probably not walk due to severe pain at this severe grade. Now, let's talk about strains. Very different, totally different. Strains relate to stretching or tearing of muscles or tendons. Tendons connect bones to muscles. The most common types of strains are to the hamstrings and the lower back. Yeah, you're going to get spasm, pain, limited motion. You're not going to see bruising. The treatment as it relates to strains is more of a short-term treatment. I mean, just think about, a very well-known sports person. I don't know, Venus or Serena Williams. Venus and Serena Williams, they're well-known tennis players. So you find out that, Serena Williams sprained some knee ligaments. She could be out for months and months. And then you hear that Venus Williams strained a hamstring muscle. Well, 2, 3, 4 days, she could be back on the court. Big difference. So let's go over the grading recommendations or protocols for strains. Grade 1, minor damage to individual muscle fibers. There's no significant hemorrhaging, minimal amounts of swelling. Grade 2, moderate strain, more extensive muscle damage, mild to moderate hemorrhaging. Muscle is not completely ruptured. Then we get to grade 3, complete rupture of the muscle, may even require surgery. So with sprains and strains, you're going to get pain. There are some commonalities there with sprains and strains. There's pain, there's swelling. Typically you want to use the RICE approach. It's an acronym: R for rest, I for ice, C compression, E elevation, and of course chiropractic care. Now before we get into the specific ICD-10 codes, I need to share with you the 7-digit extenders. See, the sprain and strain codes, they are part of the ICD-10 category called trauma or injury-related codes. Trauma and injury-related codes all begin with the letter S. S is in sprain. S is in subluxation. So these S codes, like sprains, strains, there are even traumatic subluxation codes, fractures, contusions, traumatic brain injury. I'm going to be sharing a few of these with you. So these S codes require a 7th-digit extender, which designates an encounter. So these encounters are designated in the 7th position with these 7th-digit extenders. The first one is the letter A. The letter A designates an initial encounter. The letter D for subsequent encounter, the letter S for sequela. So let's go through these examples. Okay, the letter A, again, initial encounter. You're going to use this encounter when the patient is receiving active treatment for the condition and you're the first provider that the patient visits for the condition. So, okay, let's say Mr. Williams is at home. He wants to change a light bulb. He stands on a ladder. He's changing the light bulb, falls off the ladder, hurts his back. Now he comes to you. You're the first provider that he is seeing for this particular situation. You diagnose sprained lumbar ligaments. That's going to be S33.5XX with the letter A in the 7th position. You should see the example on your screen at the bottom. S33.5XXA, sprain of lumbar ligaments with the letter A for the initial encounter. Patient came to see you first for active treatment. You see this patient 10, 15, 20 times, I don't know, whatever it takes to get the patient better, regardless of insurance. You leave the letter A on all visits. Next, the letter D, subsequent encounter. Okay, things change here. You're going to use this encounter for follow-up visits after the patient has seen another provider. So let's go with the same situation. Mr. Williams is standing on a ladder, changing a light bulb, falls off the ladder, hurts his back, decides to go to the emergency room or go to his medical doctor. MD says, Mr. Williams, no fractures, no broken bones. Why don't you go home, put ice on it, rest, see how it goes. If it's not better in a few days, then why don't you go see someone? A few days later, Mr. Williams shows up in your office. You do an analysis, an exam. You decide, this patient has sprained lumbar ligaments. Basically the same diagnosis as if he came to you initially, but you're just changing the 7th-digit extender to the letter D for subsequent encounter. It's the patient's subsequent encounter, although it's the first visit to your office. Don't confuse the patient's initial visit to your practice with choosing a subsequent encounter as the 7th digit. So Mr. Williams comes in, gets 5, 10, 15 treatments. You leave the letter D on all of those visits. And here's the last one, S for sequela. This is not typical in a chiropractic practice. Very rare do I see this being practical, so not used that often. However, you should understand when it should be used. The sequela is a late effect of the original problem. It's used for complications that arise as a result of the original problem. The example that's often given is the patient is burned in a fire, and then 6 months later, the patient develops scar tissue. So the scar tissue or the scar formation that's a sequela to the original problem. So the letter S goes in the 7th digit. All right, now let's go through some of the most common sprains and strains seen in the chiropractic setting. First one here, cervical sprain, S13.4. This is sprain of cervical ligaments. If you're going to use this diagnosis, you need to justify it. Just like you need to justify every CPT code, you want to justify every diagnosis code. So cervical sprain, again, sprains relate to ligaments. There's a nice graphic there of the major ligaments in the cervical spine. Sprains of the cervical spine, very common in whiplash type accidents where the cervical spine is hyperflexed and hyperextended. Next, we have cervical strain. Again, strain relates to muscles. There's a nice photo of the major muscles in the neck. S16.1, strain of the muscles, fascia, and tendons at the neck level. Now let's switch gears to the lower back. One of the most common strains and sprains occur in the lower back, so here we go. Lumbar sprain, S33.5. There are some of the major ligaments there in that graphic of the lumbar spine. So differentially diagnosing the difference between sprains and strains. We went over the different characteristics, so make sure you're diagnosing these conditions properly. Lumbar sprains relates to the ligaments, S33.5. And now we have lumbar strains. Strain of the lower back muscles, S39.012. The rectus spinae muscles, the latissimus dorsi, external oblique. These are some of the major muscles of the lower back. Now, oftentimes patients will come in an auto accident, or they fall off a ladder with sprains and strains. Very common. Just about every patient that came into my practice that was in a whiplash type accident, I found sprains and strains. So back in the day when we were using ICD-9 codes, it was the same code. It was one code for sprain and or strain. So with ICD-10, it's been separated. If you have a sprain and a strain, you're going to submit two codes. Now, because of the type of treatment that's required for these conditions, the health plans expect strains to heal faster. So if you diagnose a patient with cervical sprain and strain, and after about 12 visits, the strained muscles should be healing faster. So once the strained muscles are healed, then you can continue to just submit claims with sprain codes. It's actually a very good thing to do. It's actually a way to prove to anyone that's looking at your notes, whether it be an insurance company, a state board, a malpractice case, that you originally diagnosed sprain and strain, and then after 10, 12 visits, no more strained muscles, and you continue to treat the patient with the sprained ligaments. So you're proving to the insurance company or state board or malpractice case that your care is working, the patient is improving. So justifying these codes are very important. Nowadays more than ever. When ICD-10 first came around, there was what was called the grace period for the first year, where health plans were not scrutinizing the ICD-10 codes being submitted because of the initial year and this transition period. So if you use the wrong ICD-10 code, you probably were reimbursed anyway. But now the grace period is over, so more and more health plans are scrutinizing and looking at how did you justify the ICD-10 codes that you're choosing. More and more personal injury carriers are scrutinizing the diagnosis codes. You know, if you are in network with any plan, managed care plans scrutinize your diagnosis codes, and if you didn't justify it properly, they'll deny the claim. So justification of ICD-10 codes is more important now than ever. So if you're going to use, here, this is a sacroiliac sprain, S33.6. So if you're going to diagnose a patient with a sacroiliac joint sprain or sacroiliac joint subluxation, sacroiliitis, anything to do with the SI joint, there are certain things that I would recommend you do in order to justify using that code. So let's say you diagnose a patient with a sacroiliac sprain, and then you get a call from an insurance company, or if you're involved in a malpractice case, a state board issue, and they go, hey, Dr. Kotler, how did you come up with this diagnosis of sacroiliac sprain? What did you do to justify this? So hopefully you'll say, well, I did some I have some subjective findings. I have some ortho tests, chiro tests, maybe some neuro tests. So the patient came in with pain in the SI joint area, and I did some ortho tests like Yeomans and Ganslins or Faber-Pratchik. You should be doing a couple of these tests. My chiropractic findings found palpatory tenderness, hypomobility at the SI joint, muscle hypertonicity, pelvic tilt. So now I know, there's a certain group of chiropractors that are more, subluxation based, and they might say, well, Marty, I don't do ortho tests, I don't do neuro tests, I don't own a reflex hammer, I don't own a blood pressure cuff. So I understand that approach. However, it could be dangerous. If a doctor is involved in a malpractice case or a state board is looking at your notes and you've diagnosed a sacroiliac joint problem without being able to justify it, it could come back to hurt you. So do a couple of tests. You might not remember, if you've been out of chiropractic school for, 10, 15, 20 years, you might not remember how to do Ganslins or Faber-Pratchik. I could tell you, Yeomans and Ganslins are the gold standard tests, ortho tests for sacroiliac joint problems. So nowadays it's so easy. All you need to do is go to YouTube and type in Yeomans or Ganslins or Eli's or Knocklis, and you'll see all these different nice short videos on how to perform these tests. Add them to your exam findings. Now you also may see patients with, let's say, cervical disorder like cervical radiculopathy, and now your question, hey, Dr. Kotler, how did you come up with the diagnosis of cervical radiculopathy? Hopefully you'll say, well, the patient had pain from the neck radiating into the upper extremity, some numbness, some tingling. We did Jackson compression, Valsalva, shoulder depression, just a couple of these. You don't have to do all of them. Sperling, might not remember what that one is. Go check that out. Some neuro tests, yeah. Diminished reflexes, dermatome changes. We found some myotomal weakness, limited range of motion, subluxation. So these are good things to do in order to justify the diagnosis codes you choose. Remember, it's not only about justifying the CPT codes with the right verbiage, it's picking the right diagnosis codes and being able to prove it if you're ever questioned. Oh, this is a book that, I extracted a page out of a book that I recommend to all my clients, and that is, this page talks about their cervical sprain and what ortho, neuro, chiro tests, strains, cervical radiculopathy, ortho, neuro, chiro tests, cervical brachial syndrome. Patient has, you use M50 3.1 for cervical brachial syndrome. I would strongly recommend you do Wright's, ATS, and some upper limb tests. Check reflexes and muscle strength. And here's a whole bunch of other diagnosis codes that are sprains and strains: thoracic sprain, lumbar pelvic sprains, rotator cuff strains, right and left hip strains, quadricep strains, Achilles strains, jaw sprain, rib sprains, sternum sprains, sternoclavicular joint sprains. See, all these codes begin with the letter S. You need to put in a 7th digit extender. There's there's hundreds of sprain and strain codes. I've just chosen a few here, the most common ones. All right, now we're going to switch gears a little bit and talk about myofascial type injuries and myofascial pain codes, soft tissue codes, very commonly seen in chiropractic offices nationwide. Thousands and thousands and millions probably of patients suffer from myofascial type pain syndromes and conditions. So myofascial pain syndrome is a chronic disorder. It affects muscles, tissues, and the fascia. You can get referred pain. Myofascial pain can develop into certain trigger points. It could be persistent. As time goes on, the patient could say it's getting progressively worse. We're talking about an evolving situation. It's unstable. It's getting worse. Patient could have difficulty sleeping. Now, you may have heard some terms like myalgia and myositis and myofasciitis. And oftentimes, docs will say, well, what's the difference? So I put together some quick definitions. So what's the difference between myalgia, myositis, and myofasciitis? Well, myalgia refers just to muscle pain. Myositis is inflammation of the muscle. Myofasciitis is inflammation and irritation of fascia, muscles, and the surrounding connective tissue. So some of the most common conditions seen in chiropractic practices, soft tissue related diagnosis codes. There's the first one, M79.1, myofascial pain syndrome. M79.2, neuralgia, neuritis. M79.7, fibromyalgia. R53.82, chronic fatigue syndrome. And then we have a few muscle-related codes here. Muscle spasm, M62.830. I would recommend you use that if you find spasm in the thoracic and lumbar region. And then we have M62.831, muscle spasm of the calf. Now, think about this. Mrs. Jones comes into your practice. She was in an accident or some type of injury, or maybe, she just woke up feeling a lot of spasm in her neck, in the cervical region. It's pretty common, right, to have a patient come in with cervical paravertebral muscle spasm. Well, go ahead and try and look up a diagnosis code for cervical paravertebral muscle spasm. Guess what? You won't find one. So, the ICD-10 guidelines say if you cannot find a specific diagnosis and your justification is in the notes, then you can use what is called other diagnosis code. So M62.838, other muscle spasm, that's the one I would recommend you use for cervical paravertebral muscle spasm because there isn't one specifically in the neck. Now, when we talk about spasm, you may see a whole bunch of contracture diagnosis codes in your list. So what's the difference between spasm and contracture? Well, a spasm is a spontaneous abnormal contraction of a muscle. A contracture is a fixed resistance to passive stretching or of a joint due to shortening or atrophy of muscle fibers, tendons, or the development of scar tissue, fibrosis of the joints. And then we have muscle weakness, generalized muscle weakness, M62.81. Code pairing, very important. Pairing your CPT codes to your ICD-10 codes, very important in order to justify treatment. Again, I'm making a point to make sure that you understand the justification is important. The last thing you want to do is be interviewed and they ask, well, doc, how did you come up with this CPT code? And you, I don't know. How did you come up with this diagnosis code? Not sure. You want to feel comfortable and justify the codes you choose, whether they're CPTs or ICD-10s. So here's an example, manual therapy, CPT code 97140. Now I look at this pairing just like pairing food and wine. One of my favorite things to do is go to food and wine festivals. I like to learn about the pairing and how to, optimize your dining experience. So with food pairing, it's very common for meats to be paired with red wines, and white wines are paired with fish. So here we have CPT code 97140, manual therapy. That pairs beautifully with shoulder stiffness and myofascial pain syndrome. All right, just a few closing comments. Please check with all the carriers you bill prior to submitting claims based on this information to ensure that it's compliant. Target coding does not guarantee that this information will guarantee payment from any health plan or patient. Target coding is not responsible for any managed care or health plan laws, rules, guidelines that may change following this presentation, and they change all the time. So do your best to stay on top of these changes. Attend seminars, webinars, and join your national and state professional associations. Here's our contact information: info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044, HIPAA secure fax number is 844-831-2347. This is the book that I was recommending early that had the justification of all the diagnosis codes. In Chapter 3 of this book, there's a whole bunch of diagnosis codes that show you the ortho, neuro, chiro test to substantiate it. It's called the Guidebook on the Best ICD-10 and CPT Codes to Improve Reimbursement. See, learning how to bill and code isn't expensive, but neglecting it or possibly having to defend it that can get very expensive. So yeah, here's an excerpt again of one of the pages in the book where it shows you the ortho, neuro, chiro tests. And also there's a section on frequently asked questions, like what's the difference between a disc disorder and disc displacement? What's the difference between effusion, swelling, and edema? These are the questions that come in all the time from my clients. Hey, what's the difference between cervical brachial syndrome and cervical radiculitis? What's the difference between idiopathic scoliosis and thoracogenic scoliosis? And then there's a whole section on how to pair your codes. This is an example of how to pair CPT code 97110 with diagnosis codes in the cervical, thoracic, lumbar region. Gives you the verbiage. And then the book also has these cheat sheets and quick guides, which we email, which can get emailed to you so you can customize them for your practice. So these are the best for personal injury. We have a couple of cheat sheets specifically for our PI doctors. And there's also an excellent section. Chapter 1 of the book is on long-term treatment diagnosis codes and short-term treatment diagnosis codes. So think about it. If a patient comes in with a long-term treatment diagnosis of, let's say, sciatica, and a short-term treatment diagnosis of, let's say, muscle spasm, and you had to submit one of those to a health plan, which one would you pick? You're going to pick the sciatica. It's a long term. So we break those down for you in the book. Oh, another thing that we offer at Target Coding are compliance manuals. If you see Medicare patients, an OIG compliance manual is required. That's due to the the ACA, the Affordable Care Act, also known as Obamacare. And even with the present administration, compliance plans are not going to change because this was passed bipartisanly. So an OIG compliance manual, not difficult to implement, at least when we do it with you. We customize your policies and procedures. It's not a huge 500-page manual. We've narrowed it down to about 35, 40 pages with all the proper forms. You get a customizable OIG compliance manual with policies and procedures personalized for your practice. We provide you with sample mission statements. Chart audit tools, that's another thing. It's mandatory to do an internal chart audit if you see Medicare patients. We give you sample training logs, incident report forms, articles, links. This is a chart audit tool, so you would take a look at one of your charts, and we have this little spreadsheet where you go down a little checklist. Yes, I did that. Yes, I did that. No, I didn't do that. Next time I do an internal audit, I'm going to make sure I take care of that. Yes, I did this. Yes, I did that. And I have a little scoring system. You can score yourself. You could do this amongst, if you have multiple associates, they can score each other. You could have peer-to-peer reviews. And then we also offer HIPAA compliance. This is no joke anymore. HIPAA's been around for 20 years. The first 18 years was a joke because it really wasn't being enforced. It's no joke anymore. Just about every day I get articles from chiropractors, physical therapists, medical doctors being penalized for HIPAA violations. There are more and more patients complaining of HIPAA violations. It's all about cybersecurity. With all the email phishing and scams going on, with all the hackers trying to get into your system, getting a medical file is very valuable. So HIPAA compliance, more important than ever. We offer one, very comprehensive. It's a concierge type of program where we do most of the work for you. I consider it the Mercedes of HIPAA programs. There are Hondas, and that's fine. If you're looking for a Honda, nothing wrong with it. We don't sell Hondas. We sell Mercedes. Ours cost more, but you get more. Cloud-based storage portal for all your HIPAA policies and procedures. Compliance training videos. Testing for your staff with certificates that they could hang up on the wall. Business associate tracking. Now some of you might say, well, I'm HIPAA compliant. We have sign-in sheets, we talk quietly, we log out when we walk away from our computer, and we have patients sign the HIPAA notice. That's nice, but that does not make you HIPAA compliant. If for some reason the HIPAA police came knocking on your door, one of the first questions they're going to ask you is, have you done a security risk assessment? If you say no, you do not have a HIPAA program, regardless of how quietly you talk and how secure you keep your computers. If you haven't done a security risk assessment, you do not have a HIPAA compliance program. It's simple as that. So get one. If you want to do it on your own, great, but do it. If you don't want to use our company, that's fine. Find somebody to do a HIPAA program for you. Now, if you want to do it on your own, that's fine. It takes about 100 hours. That's what I've calculated. If you try to do it on your own, with us, about 10 to 15 hours and you'll be done. And then you could sleep at night. We do seminars and webinars. We have a whole bunch of seminars coming up. We have webinars that are approved for continuing education credits. We also offer memberships. This is our basic membership, $99 a month. Stop and start anytime, no contract, go month to month. And it includes our live webinars. Like we're doing a live webinar later today. It's $129. If you're a member, you could attend for free and get CE credits. Good deal. And then we have a gold membership, which is a very intense, comprehensive program. We're with you for an entire year, and we're training and training and training and showing you. And this also includes an OIG compliance manual. And then we have a platinum membership where we'll come to your office and do a full day of training plus a 1 year of follow-up. And then we also offer a free coding and compliance evaluation. If you'd like to learn more about what we do and take a quick peek on how you're doing, or just pick our brain for 15 minutes, feel free to do it. So here's our contact information again. info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044, fax number 1-844-831-2347. I see a few questions have come in already. So one of the questions I see is, people are asking about that book. So hold on, let me show you where you can get the book that I was referring to. Go to targetcoding.com and just click on the products page, and you'll see the book on the best CPT codes and ICD-10 codes to improve reimbursement. Get the long-term treatment codes, how to link, pair, match your CPTs and your ICD-10s. You get cheat sheets. The verbiage for each code, very important, just in case you're questioned, hey, Dr. Collar, why do you do neuromuscular re-education? Can you tell me how you justify manual therapy and therapeutic activities, and you're billing massage for 4 units? Tell us why, how. All in the book. Ortho, neuro, chiro tests. Qualified healthcare professionals versus clinical staff members. Big difference. Some PI carriers are making a big deal about that one. You can customize your own cheat sheets because we email them to you. So there's the information on the book. Oh, and I also mentioned that every time we do a free webinar, we within 24 hours we upload it to the Target Coding YouTube channel. Here it is. You could just go to the website and click on YouTube. You'll see the one we just did last week was on the best rehab codes. That was a good one. All right, so let's take a look and see what questions have come in now. I want to thank everybody for attending. I hope you learned a lot.